I am at the Pediatric Academic Society meeting and was invited to speak at this international conference of pediatric academic professionals. And this is on behalf of Hope for HIE, showcasing the work that we do to collaborate in clinical care, in research, in QI, and elevating the unmet needs of the HIE community globally. At this meeting, there are thousands of poster sessions, there are thousands of researchers here, and today's session was on neuro-NICU and brought together neonatologists and pediatric neurologists talking about how we take care of babies facing the most common thing is HIE. And so it was a really wonderful time to come together and talk through what our community feels are the unmet needs, where we are in the process of collaborating on research and research that matters to our community, and how we're moving that forward. So you can see the top priority, it's hard to see, but the top priority on number one for diagnosis for neuro-NICU is no surprise HIE. And one of the things I wanted to share, because there's a lot of misinformation out there from birth injury attorneys and other people out there that misrepresent or don't understand what the data means that is published. And so Dr. Lena Shalek, who is the principal investigator of the Cool Prime study, who's on our medical advisory board, has been studying HIE for decades, shared a really important piece of data that's been published about the population incidence of HIE and qualifying it. So when you don't have context or nuance, it's easy to say, oh, HIE is increasing. When you look at the actual numbers and why it says that, it's because over the past decade plus, as cooling has become standard of care, of course, when we have parameters of tracking these things for qualifying kids, you're going to see an increase in the data collection. It does not mean the incidence has increased. In fact, they actually looked at the data prior and it has not increased from doing chart reviews and things like that. So severe HIE, which we've been really good at charting for a very long time, is flat. Moderate, because those are the maybe babies to see if they're going to get cooled. We've gotten better at tracking them, as you'll see right here. And then the mild babies, which is what Dr. Shalek's research really focuses on, and seeing if cooling is a comparator for improving outcomes, because they were not a part of the original cooling studies. And you can see the tracking has gotten incredibly better as we have defined what mild HIE actually means and looks like. And all of this matters because it's HIE Awareness Month, and when we are elevating HIE awareness, and anyone out there that's elevating HIE awareness, we all have a responsibility to share accurate, sourced information from primary sources. And if you don't know what a primary source is, we'll share information about that afterwards. But it is not Google, it is not a search engine, it is not ChatGPT, it is not AI. Those things are getting better, but they do not have the ability right now to fully synthesize and share accurate information. So we go to the actual sources of data and look at the context of the published data and the data hygiene and all the elements of the data to show what we know about HIE with causation, with treatment, with tracking, with diagnosis. So some of the other work that we're showcasing at PAS that we have been contributing to on behalf of our community, so this is not just me as the executive director, but it's our staff, it's our families, one of which is developing common data elements for research. And so this is leading to the HIE registry that we've been working on. So the next, as you know, is we are leading the charge to develop long-term follow-up guidelines for HIE because none exists. And that was a topic of the conversation today in the symposium. And so we have also this results from the surveys that we did both at the Child Neurology Society meeting with the 120 child neurologists that we got together, and then the Newborn Brain Society conference where we had patient families, we had neurologists, neonatologists, PTs, developmental pediatricians, 200 people in a room, and looked at the priorities of the follow-up care that we are going to be advocating to develop these guidelines and implement them. As everyone knows, the diagnosis of HIE and how it's communicated is still very problematic, and there's a lot of big feelings and big opinions about this. We've been a part of this work group. HIE, as you may know, is under the umbrella of neonatal encephalopathy. And so we're looking at, with a group from all around the world, with patient families, with providers, all sorts of people looking at what the definition should be of neonatal encephalopathy with HIE as that identified bucket. So we're getting closer to this consensus to make the more consistent diagnosis and how it's given to families, which we know is such an unmet need of our community. And so this is another poster presentation that grabs the data from the work that we've been doing at the Child Neurology Society meeting and the Newborn Brain Society meeting. And this is solely focused on the parental perspectives that you all shared into the surveys that we have done in our community. Last but not least, we have a booth at the Pediatric Academic Society meeting. We had one last year as one of the founding advocacy partners of PAS at this conference. And so we're really looking forward to welcoming people, sharing more about how they can get our support services and materials in their NICUs, and how we can partner in advancing clinical care, improving different things with clinical care with HIE, and then looking at how we can partner in research. As always, let us know if you have any questions about why we do these conferences, the impact that we have from networking at these conferences, and how we are able to make meaningful change for our community with the expressed unmet needs from our community that we're always highlighting in our advocacy.